The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
And of course, there are no genetically transmitted birth defects. That's why my thesis, representing 20,000 autopsies, it represents 454 species of vertebrates and then 3,000 humans, and it included embryos and child, youth and teenagers and adults of all vertebrates. Well, what I found was there are no genetically transmitted diseases. There are no genetically transmitted birth defects, with the exception of some birth defects that are caused by a viral infection in the mother in early stages of pregnancy. Also, early stage of pregnancy, a prescription like thalidomide was a drug given to women, an oral drug given to women for morning sickness early in early pregnancy. And 10,000 babies were born in America without arms and legs as a result of that one prescription drug. Okay? And then, of course, there's many other street drugs and prescriptions and over-the-counter drugs and alcohol and all kinds, fetal alcohol syndrome, those kind of things. But 98% of all birth defects are caused by nutritional deficiencies of the developing embryo. And we're talking about, things of the brain and spinal cord, things like hydroencephalocele, which is spina bifida of the brain, with a hydrocele, and it can happen. I've seen babies with hydroencephalocele of the brain and spina bifida of the back, And then there's heart defects of all kinds, pieces of the heart missing, hole between the two sides of the heart. And then there's cerebral palsy. One part of the brain is significantly underdeveloped, which is the cerebellum, having to do with balance and all that kind of stuff. And then there's surgical requiring birth defects, cleft palate, belly button hernias, things like, the heart defects, and limb defects of all kinds. I mean, you see the ads on TV all the time, for the Shriners Hospital, dealing with all these poor kids who were born with all these birth defects. And I need to be working with the Shriners Hospital because we can prevent all those by giving everybody in the childbearing years, male and female, we give them the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, eliminate all the bad stuff, maximize absorption efficiency, and we will eliminate all birth defects. Now, then there's some biochemical birth defects, things like type 1 diabetes, where the number of beta cells required to make insulin in the islets of Langerhans and the pancreas, instead of having 6,000 per islet of Langerhans, you only have 6 instead of 6,000. That's why they're born type 1 diabetics. They don't make enough insulin. It's not a genetic thing. And then it's caused by these cells in the bone marrow that are manufacturing hemoglobin. For red blood cells don't get enough nutrition when the bone marrow cells are forming in the embryo, and they wind up with sickle cell anemia. They produce dysfunctional hemoglobin. And then, of course, you have things like, let's see here, you're talking about, things like autism, Autism. You're talking about behavioral problems, These things are all biochemical things. And then, of course, we're talking about things like other biochemical things. Again, type 1 diabetes. We're talking about, I think that's probably, what about muscular dystrophy and cystic fibrosis? They can be either born with those things or develop them soon after birth. They're caused by nutritional deficiency, causing disease in the liver and the pancreas, And then, of course, we're looking at Down syndrome is a nutritional deficiency when the one-celled embryo is missing one particular nutrient when it divides into two cells, and the baby gets Down syndrome. Now, it's reversible up to 2.5 months of pregnancy. I've done it with some famous people like Evel Knievel, Lauren Knievel's niece-in-law, She had an embryo that was Down syndrome. We gave her the 90 essential nutrients and got her on a gluten-free diet, and the baby's born perfectly normal. Famous story. And then we have Ben and Wendy from College Station, Houston, Texas. Okay, and at any rate, they were born both from obviously separate families about the same time, maybe 45 years ago, with Down syndrome. But our distributor there put the babies and the mothers on the 90 essential nutrients, and 16 years ago they got married. Okay, and at the same time, when they were celebrating their 16th wedding anniversary last year, Ben was retiring from working at Texas A&M as one of the administrators of their computer division of their engineering department at Texas A&M. And Wendy, the girl half of this pair, both had Down syndrome, of course. They were born that way, but we gave them the 90 essential nutrients, and their IQs got to be high, intelligent IQs, okay, even though they had Down syndrome. They had the capacity to take those nutrients. And she works for Chick-fil-A as an international director for their advertising, okay? And so it's one of those miracles that we can solve all these problems with the 90 essential nutrients.
The Youngevity UK and Europe Show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel, and for more info on the products mentioned in this week's show, check out the links in the description.